I'm David McIntosh. I'm the global scientific expert for Novartis vaccines and diagnostics. I'm also a senior lecturer at Imperial College in London. And vaccines are important for all ages of man, the 7 ages of man. Vaccines are important for infants and young children. Vaccines are important for adolescents and adults. Vaccines are important for the elderly. And there's a connection which you'll see in a minute. The great success of vaccines in infancy, especially with conjugate vaccines for pneumococcal infections, meningococcal infections, and Haemophilus influenzae B, has been slightly counterbalanced by worrying trends in the re-emergence of vaccine-preventable diseases in infants and young childhood, such as rubella infections in children, pertussis infections in children, measles infections in children. So with the great success of some vaccines, there's a need to use perhaps more traditional vaccines to prevent more traditional diseases which we thought had gone away. Now for adolescents and young adults, we have a different age group. They are susceptible to infections like meningococcal infection, and there are some wonderful vaccines already for meningococcal infection for serogroups A, C, W135 and Y. But what about serogroup B? This is a type of meningococcal infection which is prevalent, and the technique of reverse vaccinology has been used by Novartis to invent a vaccine which is expected to have a broad coverage around the world in preventing meningococcal infections caused by serogroup B. Moving on to older adults and the elderly. This group of people is susceptible to hospital-acquired infections, especially Staphylococcus aureus, which also occurs in the community, Clostridium difficile, Acinetobacter baumannii, and other such infections which can affect people who have perhaps compromise of their immune system, especially in the elderly. And it's good to see that there are vaccines being developed for these healthcare-associated type of infections. So, herd protection, that's what I was referring to before. It's possible to protect the elderly and adults by virtue of vaccinating infants and young children. This is called herd protection. And I think this is one of the greatest benefits of modern vaccines and one of the great expectations of modern vaccines, that we will be able to protect the 7 ages of man.